Hello, today we'll talk about the impingement issues that can happen in the feet of athletes and dancers. I have a skeletal model of a foot here. Let's get acquainted about the different parts of it. So the front of the foot where the toes are and these long bones here, they call the metatarsals. This portion forms the forefoot or the front of the foot. And these small squarish bones here, this portion is known as the midfoot, and the one behind here which has the heel bone, and there is a bone called the talus. This comprises of the hind foot. You have the shin bone here called the tibia, and the other fibula here. So what is impingement? Impingement usually means when two bones rub against each other, especially around a joint. They can stimulate bone growth, lead to the formation of bone projections called osteophytes, which in turn can cause pain because of friction, or they can cause compression of soft tissues like a tendon or a nerve, which can lead to symptoms as well. So this is impingement. We do see impingement problems commonly in the shoulder and the hip joint, and these can also happen in the feet and ankle as well. So let's look at the impingement issues at the forefoot. This is the big toe side. Technically we call it as the hallux, and this is the little toe side. The bones in the toes are known as the phalanges. These long bones, as I previously mentioned, they're called the metatarsals, and these joints are the metatarsophalangeal joints. So in the big toe, sometimes because of repeated impingement, there can be arthritis in the first MTP joint, and this leads to a condition called Hallux rigidus, when this joint becomes rigid and because there's no movement. And sometimes there's a compensatory mechanism when dancers have to land on their toes. They develop compensatory hyperextension. And secondly, there is a condition called Freiberg's disease, which affects the blood supply of the heads of the metatarsal. This leads to damage of the metatarsal heads, and then they heal back. But when they heal, they're not necessarily heal in the same nice anatomical architecture as they were before. There will be abnormality in the joint, and that can lead to problems, pain, and impingement. And sometimes athletes and dancers can develop instability because the joint is lax. These joints may become lax, and due to this instability, they can develop symptoms of impingement and sometimes inflammation of the lining called the synovitis. Coming to the midfoot, on the medial side or the big toe side, sometimes they can develop an osteophyte at this joint here, which abrades the tendon called the EHL or the extensor hallucis tendon. This tendon runs like this and attaches to the big toe and helps in lifting this big toe, extending the big toe. So this osteophyte here can sometimes abrade and damage the tendon. And then there's also a nerve called the deep peroneal nerve that runs here, and sometimes this osteophyte can damage that nerve and cause symptoms. On the outside of the midfoot, there is this bone called the cuboid bone. Sometimes there can be derangement between the fourth and the fifth metatarsals and the cuboid bone. This can lead to this bone getting locked in. There's a feeling of stiffness here. The athlete or the dancer experiences pain here. If with further derangement, this bone can even sublux downwards, which means it slips down slightly. So there is a fullness underneath the foot here. And there's another condition called the Sinus-Tarsi syndrome. If you see the gap here, that's the Sinus-Tarsi. There is a nerve running there, and an osteophyte there can cause impingement and pain. Sometimes just a single injection can be very diagnostic and therapeutic of this problem. Other modifications like putting a medial arch or a medial wedge can open this up and relieve the symptoms also. Best treatment is prevention, especially in the initial stages, because often most of these are overuse problems. So seek early specialist attention when the problem starts. So the simple measures could be underuse or relative rest, icing, anti-inflammatory medication, symptomatic relief by modification of footwear, padding at the local site of pain. All these are likely to help. And if they don't, sometimes a simple injection can help with the diagnosis as well as therapy. If all else fails, then surgical option is always there. Surgery is often done arthroscopically or by open means, usually for removal of an impinging osteophyte or to prevent an abrasion of a tendon, stopping it from going on to rupture. Sometimes just to decompress a nerve that's being pressed upon. So all these modalities are there, help the athlete or the dancer to get back to their sport or activity as soon as possible.